Hey everyone, and welcome to another healthcare news episode. And today we're going to be covering everything from the month of February. Thanks a lot to those who provided the feedback on my last episode, and I'm going to try to implement all of that here. So the structure of this episode is going to be a little bit different. I'm going to focus on the main headlines from this month, specifically on the Alabama ruling regarding in vitro fertilization and embryos. Then I'm going to discuss various news from this month by category, which I broke down in terms of relevance for all of us. So you notice that in the first few categories, I go into more detail about the situation and give my opinion, whereas in the later categories, I just do my best to quickly present you guys with the news so that you have an understanding of everything that's going on. And if something in particular interests you, you can just look up more about it. And once again, please leave your feedback because that's how we make the show better. You are now listening to the Gustavo Franco podcast, where we challenge the norms and uncover the truths of our healthcare system. I'm your host, Gustavo Franco. All right, everyone. So let's start off talking about the hot news in healthcare this month, which is the Alabama court ruling about IVF, or in vitro fertilization. The Alabama Supreme Court says that embryos are to be considered, quotes, unborn children. But how did they really get to this conclusion? I'm going to run us through the history of this case, and then we'll talk about the implications. What happened after the ruling, and what could it really mean for the future of IVF? This case started back in 2020 when 3 couples sued a fertility clinic after a patient picked up the embryos from liquid nitrogen and dropped them on the floor, basically killing those embryos. These parents believed that they were entitled to the damage caused to the embryos, so they sued the clinic under the Wrongful Death of a Minor Act, an act that was imposed in 1872. However, these cases were first dismissed in 2022 by the lower state courts, which said that in vitro embryos did not classify as, quote, a person or a child. The parents, of course, were not happy about this decision, so they appealed the case, and they all went together as one case to the Alabama Supreme Court. In the Supreme Court, the previous rulings from the lower state court were actually reversed by an 8-1 majority, and the court said that the parents were entitled to the damage under the 1872 Wrongful Death of a Minor Act. The court argued that the embryos should be considered a minor, and so they should fall under the law. So to finish off, we gotta remember that this ruling applies only to the 3 couples suing the fertility clinic. But we gotta also ask ourselves, what are the broader implications of this, specifically when it comes to the wording that the Supreme Court used? Alabama basically just said that from the point of conception, that is the point at which the sperm fertilizes the egg, that embryo is now to be considered a minor and a living but, quotes, unborn child. And you can only imagine the controversy that this created in our world right now. So let's talk about what it could mean in regards to abortion. To start off, this was a big win for anti-abortion activists, many of which have been fighting to give fetuses the, quote, personhood status, citing the 14th Amendment, which says that all people, quote, born or naturalized in the United States should have equal protection under the laws. So even though many may not agree with this, since the fetus or embryo hasn't been born or naturalized yet, as the amendment says, the ruling in Alabama actually supports the claim. But I want to think about it for a second, because is this really a win for all pro-life activists? And in my opinion, it's not. And that's also what most Republicans have to say. In a survey by a former Trump counselor, 85% of registered voters said that they supported increasing access to fertility services, not decreasing it. Even Trump himself publicly announced that he would strongly support the availability of IVF, and he called on Alabama lawmakers to preserve the access to IVF treatment. And most Alabama lawmakers themselves, including the state senator, have been working at that to ensure that people can continue their IVF treatments But to be honest, that has been pretty unsuccessful so far as of February 29th, with one bill to protect IVF having just been blocked. And all of that doesn't mean that there weren't immediate consequences of this ruling. Most clinics in Alabama paused their IVF services. They're still going to collect eggs from the woman, but they won't fertilize any of these eggs or actually continue the treatment with any frozen embryos that were already fertilized. Many patients were already waiting for their embryo transfers, but are now going to have to wait at least another month because of their ovulation cycles. And that'll be only if clinics actually resume their embryo transfers by then. So let's look a little closer at what this could mean for clinics and the people undergoing IVF treatment. Well, first of all, the clinics are going to want to be a lot more careful throughout the whole process. Remember, embryos now cannot be killed or destroyed because they're now considered, quotes, minors in Alabama. So to ensure their safety, the system is going to have to change. But let's quickly look at how IVF usually works. Eggs are usually first taken from the patient, or they're retrieved from the patient to be grammatically correct. They're then fertilized by the sperm outside of the body, and this forms embryos. The embryos are frozen until they're to be implanted into the uterus of the woman. But this doesn't usually work out the first time. Most transfers are usually unsuccessful. So to account for that and the fact that patients might want more kids in the future, clinics actually collect multiple eggs and make multiple embryos at once and just freeze them so that if the first one doesn't work, they can use another one. Or if the patient wants another kid in the future, they can use those embryos that are frozen. But if clinics now want to minimize potential legal issues, they won't be able to freeze multiple embryos at once in case that the first one works and then they just have a ton of embryos sitting around. So this could make the entire process lengthier and a bigger hassle to go through for all patients, allowing fewer people to actually have the treatment, decreasing its accessibility. So that's a lot about IVF already, but before we move on, I think we also have to talk about why this is so significant. We often forget that the fertility rate in the US is actually below the replacement rate, which is 2. Think of it like this. Every couple must have 2 babies to keep the population at the same number. If we're having more than 2, the population grows. Less than 2, and the population shrinks. And in 2021, our fertility rate in the US was 1.66. And the only thing that actually keeps our population growing here is immigration. So that's just to show you guys, the fertility in the US right now is super important. And most statistics say that about 8 million children in the US have been born from IVF, about 2% of all births annually. Now pair that with the fact that about 15% of couples run into fertility problems, and 42% of Americans report that they know someone or they themselves have gone through IVF treatment. And I think that's enough to prove to anyone that IVF is super relevant and an issue that we must all think about right now. And I do really want to talk about a few more implications of this ruling that are rather obscure. We don't really know the answer for most of these, and I'm sure there are interesting superstition theories out there, but I just want to bring us the questions that were raised from this ruling. First up, if someone already has a bunch of frozen embryos but conceived their baby, what are they really supposed to do with all of these frozen embryos that they just have sitting around in the clinic? If they don't want to have any more kids, but can't dispose of those embryos because of the new ruling, do they just have to keep paying for the clinic to store their embryos forever? Well, the cost of just keeping the embryo in storage is about $350 to $1,000 per year. So this is definitely something that we're going to have to consider. But now let's think about another interesting question that I saw as actually a comment in a New York Times article. In the US, as most of you probably know, we can claim children as our dependents in our tax return. So think about that for a second. If Alabama is saying that embryos count as children, can we then claim all of these embryos that we have stored up as our dependents and get tax credit up to $2,000 for each of them? See, there are just so many questions that seem off topic, but are also super relevant to the ruling. And another question that's somewhat similar to what we've discussed before is the potential for, say, genetic defects. Let's say that what some clinics are proposing actually takes effect, and couples are only able to go through IVF treatment one embryo at a time. Remember that we said that most embryos don't actually become successful transfers. But if some of those embryos actually come out to have genetic defects, what can we do to them? I mean, we can't just discard that embryo because of the new ruling. We would be killing a minor. So are we just supposed to freeze that embryo indefinitely and run another cycle of IVF? Well, I mean, it's just so complicated. And the final question that I want us all to ask ourselves is, if we think the reason for prosecution was actually correct, the case was based off of the wrongful death of a minor act, but why not as a trespassing case or as a mishandling of private property case? And what's to happen with the actual patient that dropped the embryos on the floor, because the lawsuits weren't against that patient and nothing has even been brought up in the media about that patient? So this next month is probably going to be packed with news on how we can actually answer a lot of these questions. But to discuss more news from February, let's talk about abortion, pregnancy, and other maternal and child health topics, which are showing up on news headlines and sounds pretty intuitive to talk about right now after talking about IVF. All right, so first up, we've got some interesting news about telemedicine abortions. A recent study found that abortion using pills prescribed through telemedicine and received by mail are actually just as safe and effective as those obtained in person at a clinic. And this is even more relevant now after the Dobbs decision and Roe v. Wade, since many new telemedicine abortion services have opened up. But it's not so simple, since an appeals court has ordered significant restrictions that might prevent the mailing or prescribing of these pills by telemedicine. This is now going to the Supreme Court, which will hear arguments in this case next month. So this is definitely a space for us to watch. But speaking of telemedicine abortions, recent data shows that at least 1 in 6 abortions are now actually done with pills prescribed online. That's around 14,000 abortions a month. And I mean, it's interesting because despite the bans that we've seen in the past year, the overall number of abortions provided by clinicians in the US is still higher than those before the Dobbs decision. It seems like more women are finding ways to access abortion services, whether it's through traveling to other states or ordering pills from out-of-state providers. And in response to these changes, some states have enacted abortion shield laws to protect doctors who prescribe and send abortion pills to patients in states with bans. These laws are already providing access to tens of thousands of women, especially those who cannot afford to travel for an abortion. It's a bit of a legal gray area, though, and many expect that these laws are still going to be challenged in the federal court. In a related development, a journal has actually retracted 2 studies that previously suggested some abortion pills were unsafe. These studies have been cited by a federal judge in Texas when he ruled that these drugs should be taken off the market. And now that study was just found to be wrong and was taken out of the journal. And just keep this in mind, because we're going to talk about flawed research in just a little bit. But on a slightly different note, Trump has reportedly told allies that he supports a 16-week abortion ban, which is a lot less restrictive than a lot of policies favored by much of the Republican Party. This stance will likely be a key issue in the 2024 election, especially since the Supreme Court's rulings that we've had this past year regarding stricter abortion laws in many states. But moving over internationally now, let's talk about France. Lawmakers are one step closer to actually enshrining access to abortion in the French Constitution as, quote, a guaranteed freedom. And I mean, it's funny because this move was largely inspired by the US Supreme Court's decision to overturn Roe v. Wade. And if approved, this constitutional amendment would make it much harder for future governments to repeal abortion rights in France. In other news, let's touch on some maternal and child health topics. This past month, a national body that certifies lactation consultants is investigating whether a consultant in Boise, Idaho, has been inappropriately pushing an unproven procedure on new mothers struggling to breastfeed. The procedure supposedly fixes a child's tongue tie by using laser and cutting around the tongue, and has become pretty popular despite there being very, very little evidence that it helps babies breastfeed. This case is just interesting because it highlights the need for more oversight in the field of lactation consulting, because such fields are a lot less restrictive and have less regulations than general medicine. But lastly, on a similar topic, a recent study that was presented at the Society for Maternal Fetal Medicine found that children born to mothers with pregnancy complications like high blood pressure or diabetes are more likely to develop signs of heart trouble by age 12. So there you have it, a quick summary of some of the key topics in abortion, pregnancy, and maternal and child health this month. Now, if you remember what I brought up recently, I want to talk about some flawed research, because there was pretty significant news regarding that this month. And it's also something that we should all be aware of, especially in our generation that is so quick to share the outcomes of studies without understanding what's really happening behind the scenes. And I mean, I have to be honest, even I fall prey to this sometimes when just talking to my friends and shouting out the headline of a recent study. But first up, we have a situation involving a Columbia University cancer surgeon, Dr. Sam Yoon. A study that he was involved in focusing on stomach cancer was found to have suspicious data and was quietly pulled away from the internet in 2021 without people actually noticing it. But here's where things get interesting. Dr. Yoon and one of his junior researchers have published 26 articles that have been flagged for containing suspect data. And I mean, this just raises a huge red flag about the integrity of scientific research in our world and the transparency of publishers. Now, speaking of data sleuths, let's talk about Shoto David. This guy with a PhD in cellular and molecular biology spends his time spotting errors in scientific papers. And guess what? He's finding a ton of them. From mislabeled images to manipulated data, these errors are slipping through peer review and ending up in some of the most prominent scientific journals, bringing us to question the peer review process, but also the pressure on scientists from society to produce positive results. We have to think too that the system might be at fault here, in addition to the scientists, of course, for encouraging and only rewarding those scientists who publish first very often, but also positive results. And we need to think about why researchers might put out false results. There's a pressure from society to produce these positive findings, since that's what gets the most attention and headlines. And that's what most universities are ultimately paying for. But how can we encourage negative results too? This is genuinely something that scares me a lot, because I'm often reading scientific papers, and to know that a top scientist that is publishing in top journals is actually publishing false results is quite disappointing, and brings me to question the validity of a lot of our scientific community. So beware about the information that you consume and share, and take it with a grain of salt, no matter where it comes from. All right, so now let's move on to some more general news from this month. As I mentioned in the intro, I'm just going to be listing most of these and not really analyzing them deeply like we've just done in the past categories. But these are very important, and I think that you should stay on top of all of these, especially if you're interested in a particular industry in healthcare, for which you can just check the show description or the chapter markers on your listening platform and skip to that category of news. But all right, let's get right into it. In the weight loss market, a new study on tirzepatide, which is soda's Mounjaro for diabetes and Zepbound for obesity, showed that people taking it had significantly lower blood pressure after 36 weeks. However, researchers are still trying to distinguish if this was due to the drug itself or the effects of the weight loss. There are also some early signs that suggest that medications like Ozempic and Zepbound might also boost mood and help with depression. But these drugs are becoming slightly harder to get because of such high demand, limited supply, insurance hurdles, and high costs, with prices as high as $16,000 a year. To address the supply issue, Novo Nordisk, which makes Wegovy, just acquired more manufacturing capacity by buying Catalent, a New Jersey-based manufacturing facility, in a deal valued at $16.5 billion. Similarly, Eli Lilly, to keep up with the competition, the maker of Mounjaro and Zepbound, is also looking for ambitious ways to ramp up their production in what seems to be a face-off to see which company can keep up with demand. But it's not just about increasing supply. There's also a race to develop combination treatments to prevent muscle loss, a common issue among people taking these weight loss drugs right now. Companies like Lilly are partnering with others to test compounds that could help achieve a more optimal balance of muscle and fat. And now, Lilly is already worth more than Tesla, and Novo Nordisk is the most valuable company in Europe. So I'm interested to see where this industry actually goes in the future. But one sector that is already changing because of these drugs is the food industry. As more people take these medications that suppress hunger, food companies are planning to revise their business models, either by shrinking portions, adjusting recipes, or offloading unhealthy brands. Some analysts have even suggested that unhealthy food could become, quote, the new coal, with investors actually divesting from companies that sell sugary, fatty, or ultra-processed foods. So now, after the weight loss industry, it only makes sense to talk about general pharmaceutical news, which had some interesting developments this last month. We had some top executives from Johnson & Johnson, Merck, Bristol-Myers, defending their drug prices in front of the Senate. Senator Bernie Sanders was grilling them about why we have to pay more for meds in the US than other countries. And although these top executives admitted that that's true, they argued that we now get new meds faster than any other country, and we also lead research and development. In other news, the Biden administration has made its initial offers to the makers of the first 10 prescription drugs selected for Medicare price negotiations. This is part of a new program aimed at reducing drug spending, and it's a pretty big deal. The drugs in question are used by millions of older Americans for conditions like diabetes, cancer, and heart failure. And the goal is to reach a price by August, and if successful, the program could save the government nearly $100 billion over a decade. However, the pharmaceutical industry isn't too happy about this and is arguing over the program being unconstitutional. And they're worried that allowing the government to negotiate prices will discourage companies from developing new drugs. This month, there's also been an inquiry into generic drug shortages by the FTC and HHS, especially into cancer treatment drugs. They're looking into the role of group purchasing organizations and drug distributors in these shortages. The inquiry is focusing on whether these middlemen are contributing to the problem by putting pressure on pricing and manufacturing. On the legal front, an advertising agency that helped market oxycodone will pay $350 million to states affected by the opioid crisis. The agency, Publicis Health, is accused of developing marketing campaigns that encourage doctors to prescribe the addictive drug at higher doses and for longer periods. In vaccination news, new research suggests that alternating arms for multi-dose vaccinations like COVID-19 shots may actually produce a stronger immune response. While the study focused on COVID-19 vaccines, the findings could have implications for all multi-dose vaccines. A drug called Xolair has been approved by the FDA for reducing the risk of severe reactions in children with food allergies. This is a big deal for those with severe allergies, as it can significantly reduce the odds of having a life-threatening anaphylaxis reaction after accidental exposure to allergens. And lastly, there's some exciting progress in the fight against hepatitis C. A $50 drug regimen is showing great results, and countries like Egypt are leading the charge in eliminating the virus. The same treatment cost over $160,000 just a couple of years ago. Australia is also making strides with rapid testing methods. Moving on, in recent mental health news, disparities in sleep patterns have been observed following police killings of unarmed Black individuals, with Black Americans reporting significantly lower sleep quality compared to their white counterparts. When it comes to adolescents, there's a concerning trend of more young people, particularly children and adolescents on Medicaid, being prescribed multiple psychiatric drugs simultaneously. This practice, known as polypharmacy, has risen despite the lack of comprehensive studies on its safety and long-term effects on brain development because of how the drugs interact. Stress has also been cited as a major driving factor behind drug misuse among teens, with many using substances to cope with anxiety and depression. In therapy, therapists are increasingly incorporating nature and outdoor activities into their sessions, finding that this approach can help clients feel more open and connected. This method, known as ecotherapy, is gaining popularity as a way to enhance mental well-being. Therapists and other mental health professionals also reported an increase in patients experiencing stress over global warming and its impacts. Eating disorders among adolescent boys are on the rise, with hospitalizations increasing dramatically. This shift challenges the traditional perception of eating disorders as primarily affecting girls and highlights the need for gender-inclusive research and treatment approaches. Student-led mental health clubs are becoming more prevalent in schools as a way to provide support and reduce stigma. These clubs offer a platform for students to discuss their mental health concerns and promote a more inclusive and understanding environment. Intergenerational programs are also gaining traction as a means to bridge the gap between different age groups and combat ageism. These initiatives aim to foster mutual understanding and respect, contributing to the overall well-being of both young and old participants who interact with each other now less than ever. And now for news on measles, which is becoming a global health issue and a bigger issue in the US, actually. Let's start with some important background. In 2022, there was a significant increase in cases and deaths, with an estimated 9 million cases and 136,000 deaths. This was largely tied to disruptions in routine vaccinations caused by the COVID-19 pandemic and a growing hesitancy towards vaccines. Measles outbreaks have been occurring in various parts of the world, including Europe, where cases rose more than 40-fold last year compared to 2022, with Kazakhstan experiencing a particularly large outbreak. The US has also seen its shares of cases, with small outbreaks linked to international travel. In Florida, a cluster of measles cases at an elementary school raised concerns, especially after the state's Surgeon General, Dr. Joseph Ladapo, sent a letter to parents that went against standard medical advice on how to prevent the disease from spreading. Dr. Ladapo suggested that it was up to parents to decide whether their unvaccinated children should attend school after being exposed to measles, despite the usual recommendation for a 21-day isolation period. Meanwhile, in Maryland and Virginia, health officials have identified measles cases and warned of potential exposure at Dulles International Airport and Reagan National Airport. The Virginia Department of Health has urged unvaccinated travelers to watch for symptoms and to contact their healthcare provider if they develop any. The measles vaccine is highly effective, with 2 doses providing about 97% protection against the disease. But vaccine hesitancy and misinformation have contributed to lower vaccination rates in some areas. increasing the risk of outbreaks. Health experts are now calling for increased efforts to vaccinate children to address gaps in immunization coverage and to prevent further spread of measles. Switching gears to COVID and the RSV virus, the CDC is considering a significant shift in isolation guidelines for COVID patients. The new proposal suggests that Americans might return to their daily routines just one day after being fever-free. This aligns more closely with how we handle other respiratory viruses like the flu and RSV, but it sparked some debate, especially among high-risk groups who worry about increased exposure. On the vaccine front, there's a push for older Americans to get another COVID-19 booster this spring. While the vaccines have been effective in reducing severe illness, the uptake among eligible groups has been slower than expected. Now let's talk about long COVID, a pretty scary condition in my opinion, and one that we don't understand too much about. Recent studies by the NIH suggest that it can lead to measurable cognitive decline, affecting memory, reasoning, and planning skills. But there seems to be some hope since if long COVID symptoms resolve, cognitive scores seem to bounce back. Switching gears to RSV, we've seen some confusion around vaccines this season. There have been mix-ups with pregnant women and young children receiving the wrong shots. The CDC has stepped in with recommendations to mitigate any potential risks, especially for the youngest among us. Now let's turn our attention to some Medicare and Medicaid news from the past month. Medicaid is evolving beyond just health insurance. States like North Carolina are integrating social services like food and housing into the program. This approach aims to address broader social determinants of health with the Biden administration's support. However, it sparked debate over sustainability and the potential cost increases. In a concerning trend in Medicare, there has been a staggering rise in catheter bills, suggesting a potential Medicare scam. 7 medical supply companies made suspicious claims involving thousands of Medicare beneficiaries, raising questions about the integrity of the system. The U.S. is now leading an alleged $2 billion investigation in this Medicare fraud scheme involving the urinary catheter claims. The scale of the fraud is unprecedented and shows the lack of regulation and government oversight. Unfortunately, it's also once again an example of vulnerable populations being taken advantage of. As Medicaid enrollment shrinks, clinics serving low-income communities like Bethesda Pediatrics in Texas are struggling to stay afloat with declining reimbursement rates, highlighting the challenges faced by healthcare providers reliant on Medicaid. The financial impact is widespread, with health centers nationwide experiencing revenue losses due to Medicaid, quote, unwinding. Millions of Americans, including a significant number of children, have lost coverage, affecting healthcare access for vulnerable populations. Now, let's talk about some recent developments in healthcare regulations from the past month. The No Surprises Act, which protects patients from surprise medical bills, has been a mixed bag. While it has shielded millions from unexpected charges, it also led to a surge in arbitration cases, causing administrative chaos. The law requires insurers and out-of-network providers to negotiate fair payments, but it has seen 490,000 arbitration requests, far exceeding the anticipated 22,000. This has resulted in a significant backlog and raised concerns about the sustainability of this approach. The U.S. government is tightening regulations on the collecting of human pancreases for research. This comes after concerns that some organ procurement organizations were exploiting a 2020 rule to inflate their performance metrics. The CMS is now requiring that pancreases can only be counted if used for legitimate islet cell research, addressing the issue of inflated organ procurement statistics. States are also taking action against restrictive prior authorization practices by insurance plans. Efforts are underway to limit these requirements, which often delay or deny necessary medical treatments. The FDA has also approved the first therapy for severe frostbite, a significant breakthrough for those at risk of losing digits due to extreme cold exposure. The treatment, iloprost, works by improving circulation and limiting inflammation, offering hope for a condition that has historically had limited treatment options. And now let's move on to an always interesting section. Let's dive into the AI healthcare news from this past month. First up, the Senate Finance Committee is exploring the potential of artificial intelligence in healthcare, especially for regulation and transparency. However, there are significant concerns about bias and accountability that algorithms still have. The, quote, Algorithmic Accountability Act proposed by Committee Chair Ron Wyden aims to enforce transparency and protect patients from flawed AI systems. Republicans are cautious about swift legislative action, but understand the importance of industry innovation. In more interesting healthcare news, a new AI-based system called Life2Vec has demonstrated the ability to predict death with about 78% accuracy within 4 years, using economic and health data from Denmark. While not as precise as the death calculator, the system's potential lies in its ability to highlight factors affecting lifespan and inform healthcare planning. But lead author Soon Lehman emphasizes the need for a scientific understanding of AI's predictive capabilities and cautions against unrealistic expectations of AI's predictive powers. Fabric Labs, a healthcare AI startup, has raised $60 million in funding to expand its telemedicine platform and automate clinical and administrative tasks. The company's AI-powered platform aims to streamline patient intake and symptom collection, and has already assisted in treating about 5 million patients. Fabric's recent acquisition of conversational AI startup Giant enhances its virtual care assistant, enabling patients to discuss symptoms and conditions with a chatbot. The funding will support staff expansion and further development of Fabric's AI healthcare solutions. Now let's explore some pretty interesting pieces from this month's news on general well-being. A concerning trend has emerged in the US, with alcohol-related deaths surging to nearly 500 a day in 2021, according to the CDC. This spike, which began with the COVID pandemic, has seen a nearly 30% increase in recent years, with the death rate rising faster among women than men. On a brighter note, addressing sleep issues can significantly improve mental health. Poor sleep can exacerbate anxiety, depression, and other mental health problems. Experts recommend regular sleep schedules, cognitive behavioral therapy for insomnia, and avoiding screens before bedtime to improve sleep quality, and in turn, mental well-being as well. Sleep deprivation has also been linked to significant memory loss. In other news, home blood pressure monitoring is becoming increasingly important. Due to various factors, blood pressure readings in a doctor's office may not accurately reflect your real blood pressure. Regular monitoring at home can provide a more accurate picture and help manage hypertension more effectively. Falls are a leading cause of injuries among U.S. seniors, with about 1 in 4 adults 65 and older experiencing a fall each year. Simple home modifications, regular exercise, and medical checkups can reduce the risk of falls and their associated injuries. Exercise continues to show promise in preventing various health issues, including prostate cancer. A recent study found that men who improved their fitness levels were 35% less likely to develop prostate cancer. Despite the challenges posed by the pandemic, more employees are taking sick days now than before, with most managers supporting this decision. The shift underscores the importance of prioritizing health and well-being in the workplace. Lastly, nursing homes continue to face staffing shortages and other persistent problems beyond the pandemic. The need for increased federal reimbursement rates and creative solutions to retain staff is more urgent now than ever to ensure the quality of care for our aging population. Now, let's take a look at some recent developments in the world of health insurance. A new study published in JAMA has reviewed a startling gap between the cost of health insurance and wage gains in the United States. Over the past 3 decades, health insurance premiums for families with employer coverage have significantly outpaced earnings. If premiums had remained at 8% of employees' compensation since 1988, the typical family would have earned an additional $8,774 in 2019, amounting to a cumulative loss of over $125,000 because of this increase in health insurance premiums. This shift in spending towards premiums has left less money for workers' take-home pay, contributing to financial precarity for many Americans. In other news, United Healthcare Group, the country's largest health insurer, has been hit by a cyber attack that disrupted its computer network used to transmit data between healthcare providers and insurance companies. The attack, attributed to a, quote, suspected nation-state-associated cybersecurity threat actor, caused a nationwide outage at Change Healthcare, a subsidiary of United Health. The incident left some pharmacies unable to process prescriptions and is a stark reminder of the vulnerabilities in the healthcare system's digital infrastructure. Furthermore, United Health is facing an antitrust investigation by the U.S. Department of Justice. The probe, which emerged out of concerns about the company's acquisitions of healthcare providers and data companies, adds another layer of scrutiny to United Health's expanding reach across the healthcare system. The investigation comes at United Health's Optum arm, which provides a range of health services and continues to grow in revenue and profits. In global health news, we're witnessing a variety of challenges and responses from different parts of the world, starting with climate change, which is tied to many health risks, including the emergence of new viruses and also the increase of geographical areas that mosquitoes reside. 2024 has begun with record heat worldwide, with January being the hottest month ever measured. This unprecedented warmth is not only a clear sign of global warming, but also poses significant risks to marine life and increases the likelihood of extreme weather events. And in California, a study has found that days experiencing both extreme heat and wildfire smoke simultaneously have seen disproportionate number of hospitalizations due to heart and lung problems. This compound effect is especially pronounced in communities with lower socioeconomic statuses, highlighting the intersection of climate change and health inequities. Moving on to Brazil, the country is facing a dengue emergency, with record numbers of cases reported. Experts attribute the surge to a combination of factors including El Niño and climate change. The situation is expected to worsen with predictions of over 4.2 million cases this year. In response, Brazil has started an emergency vaccination campaign using the Qdenga vaccine, although supply constraints limit its reach. Canada is making strides towards national drug coverage, with a new deal reached between government and the New Democratic Party. The plan includes near-term coverage for birth control and diabetes treatment, as well as steps towards a long-term national coverage plan. Singapore is addressing its nursing shortage by offering nurses bumper payouts of up to $100,000 over 20 years to keep them in the workforce. This move comes as the city-state grapples with an aging population and increasing pressure on hospitals. In the UK, codeine cough syrups will be made prescription only due to addiction fears. The reclassification follows reports of misuse and concerns about patients becoming addicted to the drug. Lastly, in South Korea, a significant dispute has erupted over the government's plan to address a doctor shortage by increasing medical school admissions by 2,000 starting in 2025. Trainee doctors argue that the plan fails to address the underlying issues such as harsh working conditions and the concentration of doctors in urban areas. Their widespread walkout, which began on February 19, has led to postponed surgeries and patients being turned away from emergency rooms. Despite the government's ultimatum for the doctors to return to work by February 29 or face legal repercussions, the standoff continues with no resolution in sight. And that brings us to the end of February 2024 healthcare news. If any news that I mentioned particularly interests you, feel free to shoot me a message on one of our social media platforms, and I would love to chat with you there. And once again, please leave your feedback so that we can work on making the show better. And don't forget to rate the show on your podcast listening platform. I'll see you guys for another healthcare news episode next month. And for now, stay curious, stay informed, and most importantly, stay healthy. Thank you for tuning in to this episode of the Gustavo Franco podcast. We hope our exploration of the world of healthcare has been insightful and thought-provoking for you. The opinions expressed here are ours and of our guests, and should not be considered professional advice. This podcast is a collaborative learning experience for both the producers and listeners. While we strive to convey accurate and up-to-date information, we acknowledge that our research may have limitations. We encourage all of our listeners to supplement their knowledge by conducting their own research. If you enjoyed this episode and want to stay up to date on our future releases, make sure to subscribe or follow us on your preferred podcast platform and social media. We highly value your feedback, so please don't hesitate to reach out with your thoughts, questions, or suggestions for future topics. Together, we can foster a more educated America and contribute to a more effective healthcare future. Thank you for joining us on this healthcare exploration.